First, we're going to look at the anterior view of the right thoracic wall. Here we have the ribs, the sternum, and external intercostal muscles. They are hand in the pocket direction. They are the most superficial of the intercostal muscles and fill the gap between the ribs until the midclavicular line. And after that, they form an aponeurosis and connect to the sternum. These muscles assist in elevation of the ribs during inspiration. So here we have the external intercostal muscles. When you remove that layer, deep to them are the internal intercostal muscles. They're in the opposite direction. They start at the sternum and connect to the vertebra by the aponeurosis. They assist in depressing the ribs during forced expiration. So this is the posterior aspect of the anterior thoracic wall. These are the internal intercostal muscles, and deep to them is the intercostal neurovascular bundle and innermost intercostal muscles, which are arranged in a cross-pocket direction similar to internal intercostal muscles. They're covered by endothoracic fascia, and they aid in forced expiration and stabilize the thoracic wall. So the intercostal veins, arteries, and nerves are sandwiched in between the innermost intercostal muscles and internal intercostal muscles. The name of the neurovascular bundle correlates with the number of the intercostal space. The transverse thoracic muscles are right here. They originate at the posterior surface of the sternum and the xiphoid process and insert at the costal cartilages. They draw ribs downward and assist in expiration. Internal thoracic arteries right here. It branches from the subclavian and travels lateral to the sternum. Internal thoracic veins travel along with the arteries and deliver blood to the brachiocephalic veins. The anterior intercostal arteries are supplied by the internal thoracic artery. The anterior intercostal veins drain into the internal thoracic vein, which drains to brachiocephalic veins. So this is the anterior view of the superior and posterior mediastinum. You can see the superior vena cava right here. It connects to the right atrium and delivers the oxygenated blood to the heart. This is the aortic arch and the descending thoracic aorta. They supply blood to the rest of the body, and the esophagus is right here on the right side of the thoracic aorta. Food travels to the stomach from the mouth via the esophagus, and there is the right vagus nerve right here, and then the left vagus nerve right here. The vagus nerves travel with the carotid arteries to the abdomen via the esophagus. They are cranial nerves 10. They originate at the medulla. In the thoracic cavity, they're involved in the parasympathetic innervation of the heart, which reduces the heart rate. So we're looking at the right side of the posterior thoracic wall anterior lateral view. This is the intercostal neurovascular bundle, and the veins always run superior in the bundle, and then arteries are below the veins, and then the nerves are the lowest. This is the sympathetic trunk. It provides systemic sympathetic innervation, and these bulges right here are sympathetic ganglia. The intercostal nerves are part of the somatic nervous system. They aid in contraction of muscles and return of the sensory information of the skin and parietal pleura. The intercostal nerves arise from the anterior rami of the thoracic spinal nerves from T1 to T11 and are situated between adjacent ribs. That's why they're called the intercostal nerves. The right posterior intercostal veins drain into the azygous vein, which drains blood from the thorax into superior vena cava. The azygous vein enters the thorax through the aortic hiatus, and then it travels along the right side of the vertebral column behind the esophagus and arches at the root of the right lung and ends in the superior vena cava. The posterior intercostal arteries are supplied from the aorta and anastomosed with the anterior intercostal arteries laterally somewhere in the middle. So this is the anterolateral view of the posterior wall of the thorax, the left side of the thoracic wall. You can see the posterior intercostal veins, arteries, and nerves here. The posterior intercostal veins from the left side drain into the hemiazygous vein right here, and the accessory hemiazygous vein right here. Both of these veins drain into azygous vein, which terminates at the superior vena cava. So this is the anterior thoracic cavity. Here's the right lung, here's the left lung, and then the space between the two lungs is called the mediastinum. And here we can see the superior vena cava is located between the ascending aorta and the right lung. And then here's the right phrenic nerve and the left phrenic nerve. They both originate at the C3 to C5 level and innervate the diaphragm. They're also involved in sensory innervation of pericardium and parietal pleura. This is the superior mediastinum. The veins are removed. We can better visualize the arch of aorta, which is right here in its branches. The ascending aorta terminates at the aortic arch, and aortic arch is deep to the sternal angle in the second rib. The first branch is the brachiocephalic trunk. The next is the left common carotid artery, and behind that posteriorly, the third branch is the left subclavian artery. The thyrocervical trunk on the left side originates from the left subclavian artery. You can also visualize here is the right vagus nerve and then the left vagus nerve. The left vagus nerve travels between the left common carotid artery and the left subclavian down to the aortic arch and the descending aorta. You can also see the phrenic nerve here lateral to the vagus nerve and posterior to the first rib that's cut. The aortic arch turns to the left and becomes a thoracic aorta. This is the left anterior lateral view of the neck. Here is the brachiocephalic trunk splitting into the right common carotid and right subclavian arteries. The right vertebral artery is the first branch of the subclavian. It supplies the posterior cerebral circulation. Then the next branch is the internal thoracic artery, goes downwards and supplies the anterior intercostal and pericardiophrenic arteries. Then the next branch is the thyrocervical trunk. It goes upwards and supplies the neck, cervical vertebrae, scapular muscles, and the thyroid gland. The subclavian stops at the border of the first rib and becomes axillary artery afterwards. The parietal pleura lines the pulmonary cavity. It is this shiny layer of the thoracic wall, and the visceral pleura lines the organ itself and makes organs shiny. It's the first layer of lungs. It covers lungs, blood vessels, nerves, and bronchi. Pleural cavity is the space between the visceral and parietal pleura. It's filled with serous fluid and keeps the visceral and parietal pleura attracted to another and reduces friction during respiration. Now we're going to look at the lateral view of the lungs and the costal surface. Posterior side of the lung is larger than the anterior. Here's the right lung, here's the left lung. The right lung has a superior lobe, middle lobe, and inferior lobe, and the left lung has a superior lobe and an inferior lobe. On the right side, there's a horizontal fissure and oblique fissure, which divides those three lobes. And the left lung has only an oblique fissure that divides the two lobes. So this is the medial perspective of the lungs, or the mediastinal surface next to the heart. Here's the hilum or the root of the lungs. Posterior to the hilum is the aortic compression, and anterior to the hilum is the cardiac compression right here, and the cardiac notch. The diaphragmatic surface is at the base of the lungs. It's superior to the diaphragm. On the right side here, this is the hilum, and posterior to the hilum is the esophageal impression, and the right side has a smaller cardiac impression anterior to the hilum. The pulmonary arteries right here, this one and this one, they bring deoxygenated blood from the right ventricle to the lungs for gas exchange, and pulmonary veins, this one and this one, they return oxygenated blood to the left atria. The superior pulmonary vein lies a little in front of and below the pulmonary artery, and the inferior pulmonary vein is at the lowest part of the hilum and posterior to the upper vein. Bronchus right here is the most posterior in the hilum. It's thicker and has rough edges because of the cartilage. Bronchial vessels lie usually inferior to the bronchus and posterior to the pulmonary veins. The pulmonary veins function in the systemic gas exchange, and bronchial vessels supply the lung tissue with oxygen. Now I'm going to introduce you to the heart. It's situated in the middle mediastinum. This is the fibrous pericardium. It's the outermost layer of the heart and forms the exterior of the pericardial sac. It attaches to the diaphragm and the posterior surface of the sternum, anchoring the heart in place. Here we have the parietal pericardium adhered to the fibrous pericardium. It anchors at the great vessels, and this is the visceral pericardium lining the myocardium. It is a reflection point of the great vessels. The pericardial cavity is the space between the parietal and the visceral layers. It's filled with the serous fluid. It reduces the friction and allows the heart to contract and expand. It's also a site of pathologic fluid accumulation. The left ventricle forms the apex of the heart. This is the anterior view of the heart. The ligamentum arteriosum here, it connects the pulmonary artery with the aorta. This is the landmark where the left recurrent laryngeal nerve branches from the left vagus nerve and loops around the aortic arch behind the ligamentum arteriosum, after which ascends to the larynx. This is the right anterior lateral view of the heart. We can better see the superior vena cava entering the right atrium from the top and the inferior vena cava entering the right atrium from the bottom. They're aligned but not connected. They carry deoxygenated blood into the right side of the heart. This is the inferior posterior view of the heart. Here's the base of the heart. It's where the pulmonary veins enter the left atrium and deliver oxygenated blood from the lungs. Then the blood flows from the left atrium to the left ventricle, and from the left ventricle to the aorta and the rest of the body. This is the anterior superior view of the heart. We have the SVC behind the ascending aorta, and the left coronary artery is arising from the left posterior aortic sinus. It is larger than the right, but also shorter. It divides into circumflex and anterior interventricular arteries. The circumflex follows the left part of the coronary sulcus. You can't really see it here it's below the left auricle. It feeds the left atrium and left ventricle. And the anterior interventricular artery is also called left anterior descending artery, or the widowmaker. It descends and passes behind the pulmonary artery right here, then extends to the anterior longitudinal sulcus, where it nourishes both ventricles. This is the right ventricle, and here's the left ventricle. Next to it usually is the anterior interventricular vein. The right coronary artery extends from the right anterior aortic sinus to the right coronary sulcus. It supplies the right atrium and right ventricle and part of the left ventricle. So this is the inferior view of the heart. You can see the continuation of the right coronary artery along the diaphragmatic surface, becoming the posterior interventricular artery, extending down the apex of the heart. It's also called the posterior descending artery. It has middle cardiac vein running next to it. The origin of the middle cardiac vein is usually variable. The small cardiac vein here travels in the right atrioventricular groove alongside with the right coronary artery. Here is the right atrium and the right ventricle. And the great cardiac vein comes around the left side of the heart and separates the left ventricle with the left atrium. All these three cardiac veins empty into the coronary sinus, which is right here. The coronary sinus empty the venous blood into the right atrium. This is the anterior superior view of the heart. We can better see the left coronary artery dividing into circumflex right here and into the anterior interventricular branch, or LAD, over here. And we can also better visualize the anterior interventricular vein that supplies the great cardiac vein right here. This is the internal superior view of the right atrium. This is the opening of the superior vena cava that's reflected, and this is the opening of the inferior vena cava. And this little thumbprint here is called fossa ovalis. It used to be open during fetal circulation. It closes during early childhood. And this is the opening of the coronary sinus. Blood enters the right atrium from the surface of the heart through the sinus. Here is the right atrioventricular valve, which is also called the tricuspid valve. When the valve is open, blood goes from the right atrium to the right ventricle. And here we have the smooth parts called the crista terminalis, or the terminal crust. And the rough parts of the heart are the pectinate muscles. They line the inner portion of the right atrium. This is the anterior view of the internal right ventricle. The right ventricle extends from the right atrium to near the apex of the heart. Blood flows from the right atrium to the right ventricle through the tricuspid valve. The papillary muscles right here, they anchor the valves using these string-like structures called chordae tendineae that prevents prolapse and the backflow of the blood. The trabecular carni right here are net-like meat. They line the ventricle and provide extra space to prevent the ventricles sticking together. And the septum marginal trabecular right here, they coordinate contraction, and it's only seen in the right ventricle. And the blood leaves the right ventricle to the lungs via the pulmonary valve, which is right here. This is the superior view of the heart. The pulmonary valve is located most anteriorly in the heart, and posterior to that is the aortic valve, which is located anterior to the left atrium and pulmonary veins. During systole, the pulmonary and aortic valves open, and they close during diastole. This is the internal posterior view of the left atrium. This is the left auricle located superior to the left atrium. It's lined with pectinate muscle. Blood flows from the lungs into the left atrium via the pulmonary veins. There's usually two veins on each side of the atrium. Blood flows from the left atrium to the left ventricle via the left atrioventricular valve, which is also called the mitral valve. The atrioventricular valves are open during diastole and closed during systole. Here I want to show you the fossa ovalis in the left atrium. Earlier we saw in the right atrium, it used to be a hole in the interatrial septum. It's normally open in infancy and fetal development, and closes during early childhood and becomes a thumbprint-sized depression. So this is the anterior view of the left ventricle. Here we can better see the myocardium. It's the thickest layer of the heart wall. It's between the endocardium and epicardium, which is the outermost layer of the heart. The walls of the left ventricle are 3 times thicker than the right ventricle. Endocardium is deep to the myocardium. It lines the inner chambers of the heart. And here the papillary muscles, they anchor the mitral valve using the chordae tendineae and coordinate contraction. The septum marginal trabecular are not present here. And the trabecular carni are net-like meat. They provide extra space to prevent the ventricles from sticking together. Then the blood travels from the left ventricle to the aorta through the aortic valve, and to the rest of the body through the aortic arch and the descending aorta.